Good morning everyone. Leanne Wells, CEO of Consumers Health Forum of Australia. We've just had the federal budget last night and I just wanted to share with you some headline reactions from CHF to the budget. One of the things we advocate for and have done over the years stridently at CHF is out-of-pocket costs. That's a big issue for the community. It really matters to consumers. And we know that affordability and access to frontline primary care and medications is something that really matters to people. It comes up time and time again in pre-election polling. And we know that many people don't go to the doctor and don't fill scripts because of costs, because of those out-of-cost issues. So out-of-pocket costs is a pain point in our health system, something that we need to do something about. That's why we've welcomed some of the features in this year's budget. We've welcomed the general practice initiative in the budget that's aimed at the over 70s. More than half of people over 70 have 2 or more chronic conditions. They need coordinated, convenient and affordable care. So this measure will see them access consultations by phone and Skype. And their GPs will be able to use additional funding over and above the usual Medicare arrangements to boost services to them. But it'll also be convenient too, because we're shifting away from the old Medicare rules to bring the system into the 21st century. Older people over 70 will be able to get services from their GP by telephone and Skype. That's got to be a good thing. We've also welcomed the stop on the freeze on Medicare rebates from July. That will also help make visits to the doctor more affordable for the whole of the population. And we welcomed a website that'll carry information about specialist fees and charges, making these much more transparent to patients. That will be a good thing, but the big proviso there is that we need the specialists and the surgeons to cooperate and put their data onto a website like that. The other big ticket item, of course, was mental health and suicide prevention. This touches so many of us in the community. We've welcomed that new area of spending. It includes a measure that we're particularly interested in and intrigued by, a trial of new adult mental health drop-in centres. That's a good concept too, provided those services are well integrated with other services. So the downsides, there were 3 main downsides to our mind. Obesity, no mention of that word. No big plan to tackle that issue. It's a major public health issue. It's a real sleeper and it's going to be something that hits our system in the form of enormous costs that will affect the sustainability and responsiveness of our system. We've simply got to do something to arrest it. No plan for that. Dental and oral health. It was good that there was a focus on children and children's dental health, but nothing for the adults who simply can't afford good dental care. The other thing we'd comment on is of course the failure to raise the rate for New Start. Having a meal on the table, somewhere to live, being warm, being able to afford to have a heater on is a fundamental social part of the social determinants of health. We do need to think about the social determinants of health. They're not the soft underbelly, so we have certainly lent our voice and supported the growing groundswell of support for that, from ranging from ACOS through to the Business Council, that New Start has to be raised, the rate has to be raised. So there are our top lines, there are our initial reactions. We'll be running a webinar next week on the 9th of April at 12:30 if you want to know more analysis from us about the consumer impact. Thank you.